now to check the patient's lung, we are going to check for the breath patterns and the breath sounds. We're going to do it both posteriorly and anteriorly, but we'll start on the anterior side. With each time I place it, she'll take a deep breath in. And now posteriorly. All right. Now to test our pulse ox, we'll take our pulsometer. We will place it on their index finger. We will strongly suggest like no fingernail polish or long nails just to get a better reading on it. So go ahead and place it on their index finger. We'll go ahead and turn that on. We'll wait about 20 seconds for that to load, but we're looking for numbers between 96 and 100. And as we wait for it to come up. Right now, so hers is at 97, as you can see. So that's right in range and looking great. All right, next we are going to be using the peak flow meter to be testing the maximal flow rate during the forceful exertion of your breath. So we're going to be using this. We're going to test it 3 times. Each time we are going to set it back down to 0. So I'm going to set this to 0. They're going to inhale, take a big inhale, and then they're going to put this up to their mouth, and then they're going to exhale as hard and as fast as they can. And we're going to do this 3 times. So first time, we're going to set it to 0. They're going to inhale, grab it, and then go ahead and put it around their mouth and blow as hard and fast as they can. All right, I'm going to take it back. I'm going to record it, set it back to 0, and we're going to do the exact same thing. Deep inhale and exhale hard and fast. Same exact thing, one more time. Put it back to 0. All right, and then we'll record it. And so personally, I wouldn't recommend that you taking these supplements, even though your friend gave it to you. If you are concerned about your endurance or breathing, this is a conversation that we can have. Maybe adding some exercise or endurance breathing exercises to help you with that. But normally, when people take any type of supplements or anything like that, for example, asthma, they'll use an inhaler to open up their lungs. But that's a condition that they have, and that's how they handle that. But yeah, I wouldn't suggest you taking that supplement if there's no true evidence behind it to back up anything. Yeah. I see that you will be running a 10K at a higher altitude of 6,000 feet. So with doing that, before the race, definitely I would show up several days before just to get your body acclimated to that environment. But leading up to that race, since it is 2 months out, I would definitely start increasing your intensity, just to get your body just used to working harder than what's going to have to, just being so high up with the altitude. I would also make sure that you're getting enough carbohydrates leading up to that, and also staying hydrated. Once you get up there and you start the race, make sure you pay attention to any type of like headaches, dizziness, any sicknesses, just like altitude sickness. And then when you start your race, make sure you pace very conservative, and then make sure you're good before you start working yourself too hard, just being that so far up.